Thank you, Jerry, and thank you all for having me here today. So we're going to talk a little bit about value-based care, a term that is used, I would say, quite widely in healthcare these days. But before we get into the description of value-based care, we're going to talk a little bit about the performance of the Canadian healthcare system. So if you take a look up on the screen here, you'll see Canada is listed at the top. We're listed at the top for healthcare spending as a percentage of our age-adjusted GDP. So we invest a lot of money in our healthcare, which we would think is an excellent thing. However, when we look at the outcomes that our population are receiving for the amount of money that's being invested, we start to see that there's a little bit of a challenge here. So we are the first in our spending as a share of the economy. And just to clarify, we're comparing all the OECD countries. However, when we're looking at these 30 countries, we are 28th on the list of access to physicians. We rate 23rd on access to acute care beds, 25th on access to MRI, 26th on access to CT, and in fact, we're last on access to surgical wait times. And we're not out of the woods yet, because I think all of you can relate to the fact that we are about to live a series of growing and upcoming challenges in healthcare pertaining to manpower shortage, an aging population, which brings about obviously an increased burden of disease. And so the concept behind value-based care is that we are creating value, not just for the system, but really value for the patient by measuring outcomes that are important to patients. So by that, we mean quality of life, reduction in time spent in hospital, whatever it is that the patient says is of value to them, over obviously the total cost to create those outcomes. So what we see right now in healthcare is that we spend a lot of time. I don't know if my pointer's going to work. I guess not. That's okay. I got to drag it over. Okay. There we go. We spent a lot of time measuring here, process and structure. So what I mean by that is if we take an example of a surgeon that is asked to remove an appendix for a patient, the government currently will measure how many appendix surgeries that we're doing in a year. And we get congratulated if we meet our target for 100 appendix surgeries in that year. However, if the surgeon ends up killing 30 of the 100 patients, or worse, 50 of the 100 patients, nobody will notice. We will still get congratulated for doing our 100 appendix surgeries every year because no one is looking at the outcomes of the patient. So we've got to start thinking about how we can measure outcomes that are more clinically relevant for patients, such as the patient's social determinants of health, their risk, their status, their engagement, experience, compliance, and their actual clinical outcome measures. And so value-based care is a research-based model that was started by Porter several years ago. Porter and Teisberg were the two authors. They came out of Harvard. And their implementation model involves us doing 6 things. And you'll see there are check marks on 5 of the 6 because 5 of the 6 are pretty much within our control. One is to organize into integrated practice units, which means you're designing care around the medical condition of a patient. Second is to measure outcomes and costs for every patient. Third, which we have out of our control, which is moving to bundled payments for care cycles. So that lives with our policymakers. Fourth is integration of care across distinct facilities. And the fifth is expanding exceptional services across geography. And obviously, all of this is supported by some sort of technology infrastructure, pardon me. And so within our organization, we've tried to start going down this journey. And I have to say it's a journey. Value-based care isn't something that you can do within a year or 2 years or 5 years. It is a continuous improvement journey that we've got to pursue over time. And so we do have integrated practice units incorporated into our strategy. In fact, our cancer center has one specific for colorectal cancer. We are trying to make a virtual care shift so that we can facilitate access and coordination of care for our patients by bringing technology to them. We're looking at costs through a costing tool that's actually available across the entire province of Quebec that allows us to do something called time-driven activity-based costing. We are looking at care variability and obviously patient-reported outcomes and patient experience measures to look at shared decision-making with our patients. So why is value-based care relevant in cancer care? Well, there are 3 main components: high complexity, There are a lot of challenges in patients navigating their treatment. And this journey, unfortunately, when it's not well coordinated, often leads to fragmentation of care. There is a negative impact on patient outcomes when that happens. The second issue is high costs. So we know that there are rising drug costs. And although in Canada, a lot of our healthcare is covered, there are well-published reports telling us that there is significant financial stress for patients and families as they navigate the treatment journey, especially if it requires them to take time off work. And obviously, the third issue is disparities in access to timely and equitable care. And the third big bucket that leads us to think about value-based care and cancer care is the emotional burden. And this has an impact on outcomes, and it has an impact on patient satisfaction. So when we think back to the first two slides that I had at the beginning, it leads us to think about the importance of performance metrics. We're probably measuring the wrong thing, which means that in absence of an adequate measure, our potential to achieve the results that create value actually collapses. So the first and most critical component of value-based care is to look at robust data collection. And so this helps expedite research, it helps us enhance performance, it helps us create value and really drive innovation. And within our organization, there are a series of tools that we've built out to help us to be able to do that. We're able to now look at costs and outcomes for every patient throughout their trajectory of care. We're able to start doing some population analyses while preserving patient confidentiality with the generation of synthetic data via MD clone. And we're working on building a connected health record to support the entire continuum of care that's truly patient-centric across the entire journey and not just dedicated to hospital. And so this is where you start to see a story of what's really going on in terms of your costs and your investment in healthcare. So when we are able to actually merge the costs of the patient and the outcomes, you can see that when there are negative outcomes, even if there are fewer of them, the costs are dramatically higher. The next thing that we want to look at is also measuring adherence to best practice. We know these guidelines exist. We know in research, especially in cancer care, we're generating new best practice all the time. But how closely are our clinicians actually adhering to the guidelines that we know are the right thing to do? And so by starting to measure the adherence to best practice, it gives us insight on where we can reduce any variability in care. And the next, and I would say most important component of value-based care is really empowering the patients via shared decision-making. So patients need to understand what their treatment outcomes are going to be. They need to have that information readily available to them so that they can be active partners in care and advocates for their own healthcare in deciding which path they want to take. And so we are trying to make that information more accessible to patients. We're in the process of deploying a tool called ZDoc, which will allow real-time analysis of patient-reported outcome results. And the idea is to get those in the hands of our clinicians and the hands of our patients so that they can have conversations about their care. The next component is really to leverage technology and innovation to streamline the care delivery process. So implementing care management platforms to coordinate care across multidisciplinary teams. I know in oncology here, we do have an application known as Belong that helps patients engage with their care providers and get information about their journey. Telehealth and remote monitoring solutions also bring care back to the patient, and AI and machine learning algorithms are becoming more and more important to help support decision-making and predictive analytics. And in fact, one of the things that we did here is that we deployed, as Dr. Battis alluded to earlier, about 2.5 years ago now, a hospital at home program that allows our patients to be able to benefit from acute care in their home. And we'll loop back to that a little bit. But this transformation to virtual care really is what helps bring care closer to the patient. And right now we're trying to do a series of these things across the organization, regardless of your diagnosis, but to really help empower patients to become advocates and active participants in their care and reduce some of our manpower shortages with the goal of improving outcomes. So if we look at some of the outcomes that we had in hospital at home where we now allow patients to receive acute level hospital care in the comfort of their home with care providers that are there 24/7, able to monitor them wearing wearables, able to respond to any distress that they may have and do intensive teaching and support in the home. We see that 100% of our patients recommend the program, as do 100% of the caregivers. They're reporting their patient comfort level at 83%. 89% report facilitated recovery, and 89% reporting having all the necessary information to manage their care. And interestingly, when you look at the impact on the system, we see that we have made a significant difference. We use 46% less staff. We're saving 1.5 million less costs compared to inpatient care. And a part of that cost is the operational functioning, but another part of that cost is reduction in unnecessary testing that leads to increased length of stay and exposure to all the viruses that we're exposed to in hospital. And additionally, we've saved significant amount of bed days. And so we all need to collaborate to be able to get to the goal of value-based care. Value is actually a shared language among patients, physicians, payers, providers that can bring the stakeholders together around a common cause. So we need our physicians to help advocate for innovation and patient engagement. We need our patient advocacy groups to amplify the voices that support policy change around value-based care. We have to look at collaboration opportunities between industry, research, clinicians, and patients to develop solutions that will really improve patient outcomes. And that's it for me. Thank you.